Can you explain more about the types of shields technologists use?
Because of the risks of radiation, shields are available to protect the most vulnerable organs. In the video, the students wore a typical lead apron and a thyroid shield. In the practice session, the patient wore a half apron to protect their reproductive organs.
What other ways do students and technologists protect themselves?
During the training program, we learn to use time, distance, and shielding to protect ourselves. We spend the least amount of time in the room when there is radiation, use as much distance as possible from the source of the radiation if we do have to be in the room, and use many different types of shields. Control booths are equipped with special glass windows and lead walls. The goal is to keep the dose as low as possible.
The instructor helped the students create an image of a foot. What was that?
We often use phantoms of bodies and/or body parts during practices. This one was a clear phantom that allowed all the bones to be seen. Obviously, positioning a real patient is different, and that is why students frequently practice on others without doing exposures. The advantage of phantoms is that there is no risk to them, so we can produce images.
I'd like to know more about selecting the radiation levels. It sounds like a lot of responsibility.
For each image, technical factors are selected on the control panel. There are many things that impact the selection, including the body part being imaged, the equipment, and the size and age of the patient. The video discussed that KVP, or quality or strength of the radiation, is selected as well as MAS, which is quantity of radiation. Students spend a lot of time in their didactic classes learning about this, and because it's a big responsibility, they are supervised until they demonstrate competency.
How much time do students spend in actual clinic experience with patients compared to the amount of time they're in class and studying?
Programs vary a lot in how classes and clinicals are structured, but it is probably about half and half. If you are investigating schools, this would be a great question to ask.